Hello and good afternoon. Did you know that 42% of people in the U.S. have tried marijuana at least once? Medical marijuana is a very interesting topic in the U.S. because there's so much controversy over it. Marijuana is a great topic that I have found because it's such a controversial medication. Is it a crime or a medicine? You decide. Asenjo, the author of the book Marijuana, explains that marijuana is made from leaves of the hemp plant, which has active principles in it called cannabinoids. He also explains that its many nicknames include grass, pot, Mary Jane, reefer, and cannabis, which is derived from cannabis sativa, the scientific name for hemp. William Goodwin, the author of the book The Debate Over Medical Marijuana, says that marijuana contains over 400 different identifiable chemical constituents, including steroids and vitamin A. Procon, the website, states that the scientists found that ammonia levels were 20 times higher in marijuana smoke than in tobacco smoke, while hydrogen cyanide, nitric oxide, and certain aromatic amines occurred at levels 3 to 5 times higher in marijuana smoke. Goodwin explains that there are some limited circumstances in which we recommend smoking marijuana for medical uses. The accumulated data indicates a potential therapeutic value for cannabinoid drugs, particularly for symptoms such as pain relief, control of nausea and vomiting, and appetite stimulation. For patients such as those with AIDS or who are undergoing chemotherapy and who suffer simultaneously from severe pain, nausea, and loss of appetite, cannabinoid drugs might offer a broad spectrum of relief not found in any other single medication. Asenjo explains that marijuana can be useful in treating pain, nausea, and appetite loss caused by the advanced cancer and AIDS for very ill patients with no other treatment options. Investigators recommended short-term use of smoked marijuana under strict medical oversight. Procon says that it is used illegally because of the high feeling you can get off smoking pot. Asenjo also states that marijuana is most popularly used for its euphoric properties. Procon basically explains that it is sending the wrong message to kids, pretty much stating that the drug is not bad because it is even a medicine. Goodwin explains that the Supreme Court classified marijuana as a Class 1 drug, which means it is not bad and it can be sold as a medication. However, the Procon states that more teens smoke pot where it's legal than where it is not. Procon says that marijuana is not really a solution. Marijuana is a very strong painkiller. Goodwin says most notably cannabis has been credited with reducing nausea and pain while improving appetite and a variety of movement problems. Procon expressed that some patients with terminal illnesses do not respond well to their medication, and marijuana is a good alternative to their medication. Asenjo says given a cigarette of comparable weight, as much as 4 times the amount of tar can be deposited in the lungs of marijuana smokers as in the lungs of a tobacco smoker. He also states men that smoke pot experience bronchitis, coughing, and chest pains, and also can reduce sperm production and testosterone levels. Procon states that 20 of 50 U.S. states and D.C. have legalized the medical use of marijuana. Goodwin expressed that the debate of legalizing marijuana started around 1996. Procon says that no studies have shown an increase in drug use after marijuana in teens. Marijuana is used illegally and legally both as a medication in the drugstore and a drug on the street. Marijuana has a pretty good medicinal value stopping cancer-causing cells, but it also is worse than cigarettes for your lungs. Pot is used as a medication when you can't recover from your illness, which would be helpful by helping you not think about your evident future. The way marijuana seems to be going, pot is going to be legalized in all of the states in a couple of years. Do you think it should be a legal medication? From the Pot House, Danny Gloriod, Marijuana News.